morning if we have any East Coast viewers, and of course to our guests today. Good morning to you. Today's episode, I have been looking forward to this personally because there's no topic which is more relevant to the world today than about COVID. I am just very happy and grateful that our guest said yes to my invitation to tell us his personal story, their personal story about how they coped up with being afflicted by COVID at a time when the world was still struggling with how to deal with the virus. That time, nobody was yet able to know exactly what's happening around, what do we do, and that can be attested by our guest tonight. But before that, I would like to say, of course, as always, thank you to those of you who have been waiting since this morning because I made the mistake of putting it at 10 a.m. Korea time. My mistake. Thank you for those who messaged me about that so I was able to adjust it. So thank you. As always, I will put in your comments later as we go along. In the meantime, let's not delay it any further. Let's all welcome Mr. John.
Hi, morning.
Good morning. Thank you very much, John, for being with us
No
tonight,
problem.
our time, morning, your time. Please tell us a little bit about yourself.
Um, John, I'm 42 years old. I live in the United States, New Jersey. Um, I work in a hospital, level one trauma hospital here in New Jersey. And I got afflicted with COVID. I missed almost a year of my life. Oh, I'm married and I have a daughter. And
Yeah, that
my wife
was
also works. My wife is a
a
nurse. She
year
also
of
works
your
in the
life,
hospital.
right?
Yeah.
And I saw the reason why I was really very interested to have John here with us was because I saw his wife is a schoolmate of mine back in elementary days in Iloilo. I saw the posts that they had, that she had, and the struggles. I think all of us were worried about that. We just don't know, didn't know what to do. So let's hear it from you, directly from you tonight. In the meantime, let's backtrack a little. Uh, I know you've been living there in the US since you were young, right?
Yeah, I came here. I came to the United States when I was five, 5 or 6. Yeah, I was born in Manila, and I came here 1985, I think, and I've been living here ever
So
since.
how did you and Christine?
Oh, my best friend at NYU happened to be her classmate in elementary school. So back then, before Facebook, before all this social media, we had Friendster, and so we met through there. We were both on our friends. We were both on our mutual friends Friendster, and we just started talking from there.
Yeah, that's I'm sure interesting story to hear. So you were already there, and then Christine is a nurse. She went to the US, and that's how you got married, and
Yeah.
the rest is history.
No, we got married in the Philippines.
So you work in a hospital.
Yeah.
I'm sorry.
No, we got married in the Philippines.
Ah, okay. You got married in the
Yeah.
Philippines, and then
And
both
then
of
she
you
came
went.
here.
You went home,
Yeah.
and then you started a family. You have one. They have one daughter.
Yeah. Yeah. She's gonna be
All
13 in
right.
a few days.
You are working in a hospital. I'm sorry.
No, I'm just saying my daughter's is gonna be 13 in a few days.
Oh, wow.
Yeah.
All the three of you are April celebrants, right?
Yeah.
Belated happy birthday to you and to Christine, and advance happy birthday to JC.
Thank you.
So now you are working in a hospital at the patient care access. So you are like the first in line to meet the patients.
Yes, yes. Um, most times they meet us before they meet the nurse or even the doctor.
All right. So we would like to talk about last year because John and Christine, the wife, they both live and work in New Jersey, which is just 15 minutes away from Manhattan,
Yeah.
which was we all know, the epicenter of the first wave in the US. Can you let us know how was it? How was it
Hi,
when the world was already talking about?
Wendy. I'm sorry, your microphone is breaking up.
Oh, it's the internet connection again. All right. So I'll try again. How
Okay.
was it in New York, in New Jersey, when the world was still, when that part, your part of the world was still hearing
Okay.
about COVID in China, in Korea, in Asia? How did you in the US take that information?
Well, you see, the rest of the world already knew about COVID, like Asia, China, Japan, Europe. They knew about COVID from like the second half of 2019. The US never heard of it. I never saw any news about it until like 2020 or like the very end, like December 2019. So we really didn't know anything about it. We really had no idea about it. But it was just, but every day it was just on the news, like it's spreading. It's, so many people are getting sick, so many people are dying. But really in the United States, as far as late as December 2019, we didn't really know anything about it. And then
Yeah, and
suddenly, and then it just got like almost every day you couldn't turn on the news without something about COVID, like it's spreading, like millions of people are already infected. And then suddenly, like in this January 2020, that's when the US started really taking it, like, they started worrying that it could spread to us. And so that's when like our local government, like the US government started letting people know like this could happen here. But as late as 2019, we really didn't know anything about it. We just knew that there was something, there was something spreading, but it was spreading like in China and Vietnam, Cambodia, all these places. But we really had no idea it was going to come here.
yeah, and I think on the first uh, January there was still some uh, news blackout from China about the COVID situation there in um, what's the name of the place? Um,
Oh, in
but
Wuhan.
in Wuhan, that's right. I'm so
Yeah.
sorry. I forgot that very important information. Now, was there skepticism at first in the US? Because we heard that not everyone believed about the
Oh yeah,
virus. That's,
it was for some reason the president at the time, Trump, he made it very political. He made it seem like the Democrats were trying to attack him again using this virus, and I don't understand why anybody would think that. So as soon as Donald Trump made it political, like tens of millions of people in the United States automatically just didn't believe it because they followed the president, and whatever the president says they believe. And as soon as the president showed doubt that this was a real thing, then automatically they just shut off and said, "Oh, this is not real."
yeah, so what was the impact on you as a frontliner?
Well,
The preparation of the hospital, your protection?
well, my family, we always believed it. We always, we always believed something was going to happen. So we would always, wash our hands, wear a mask. We would sterilize. We would sanitize everything. Walking around, we would buy disinfectant. And we didn't go out. We didn't really go like to the movies. This was before when movies were still open. We didn't go to the movies. We didn't go to the restaurants. Um, so that was what we did as our part. As far as the hospital was, we actually, my hospital in particular, we set up a tent, an isolation tent. Normally, the patients would just come in directly to the emergency room and be seen there, triage there. But we set up an isolation tent outside the hospital, which would be used to take in patients so that to minimize exposure. And that lasted for a couple of months uh, before the hospital realized that it just would not make sense. It just, there was just hundreds of people every day or like thousands of people every week just coming in, and they would all have COVID, and it would just be pointless to try to do the isolation part, because it's like a tidal wave that was just coming in, and it was just too much.
So,
Um, but the hospital set up. They realized that COVID was spread through droplets, so they set up like plastic barriers all around the patient areas to separate the employees from the patients. They set up visiting protocols to determine whether visitors can be there or not. Up to now, it's been more than a year since we had our first case. Up to now, we still have visiting protocols. They only allow like one visitor, and that one visitor, it depends on where the patient is.
mhm.
Otherwise they don't allow visitors at all in the hospital.
But in your case, even though your family believed and took precautions to, do something about against the COVID situation, and
Mhm.
then eventually the hospital followed, when did you get afflicted by the virus? And how did you get afflicted by the virus?
I I got I test. I'm sorry. I woke up with a fever April 7th,
So
2020.
that's
I woke.
fourth month.
Yeah. So I think I got infected maybe last week of March, because it takes
Mm-hmm.
about 10 days for symptoms to show up. So maybe around the end of March I got affected. I think I got it from one of my coworkers, because she had come to work, and she had like flu-like symptoms, and eventually she would test positive for COVID. So I think I got it from her. And understand, this was in March, so this was before like there was heavy emphasis on like wearing masks and heavy emphasis on social distancing.
Mm-hmm.
So like when we were working in the same office. We were talking to each other. We would go to the lounge, to the break room together, and eat together. So this was really before they emphasized, separating, staying away from each other, and wearing masks. So I think I got it from one of my coworkers, end of March, and then my symptoms started April 7th.
Oh, wow. So from January to March, you were not wearing masks in the hospital and no barrier.
No, yeah, that's right. Yeah,
Ah, yeah, because we've heard news, because here in Korea, everybody masked up already, and we were like, uh, bewildered. Why are the Americans not believing in the safety that the mask offers?
yeah. The hospital didn't start letting us wear masks until like maybe March or mid March or something like that, and then they would provide us with like N90. They would provide the employees with N95 masks when they come into work. But yeah, but we didn't. The Americans as a whole didn't start wearing masks until like, yeah, until like end of February, March.
Yeah, and as early as February, or even no, February, because that's when the virus really got in settled here in Korea. All the medical practitioners, the frontliners, were already wearing PPE all over. So
Yeah,
that didn't happen yet at that time in the US or in the hospital where you were working.
no, that we didn't. I mean, they would, the nurses and the doctors would, like the ones that were actually like the medical staff would, because they put them under isolation protocols, the droplet protocol, so they would wear the PPE head to toe. But as far as like the regular staff, they didn't get to wear the PPEs. I mean, they would get masks, but they wouldn't get like the gowns or anything like that until much later.
So in your case, because you were in the patient care access, that's when the patients, you are the very first person, your department is the very first department that the patients
Yeah,
face.
so
You
they
were
gave us like the PPE. Yeah,
and you were very prone to, being afflicted by that because you were face to face with
yeah,
the patients who were not even diagnosed yet that time, right? And they
exactly.
could
Yeah,
possibly have the virus already.
yeah. That's why around March, end of March, that's when the hospital started setting up plastic barriers between the employees and the patients.
Yeah, but by then it was a little bit too late for you. And
Yeah,
Christine, who is working as a nurse, also had her own, was
yeah,
also
yeah,
afflicted by COVID.
yeah. Mhm.
How did she get afflicted by COVID? Was it through you or in the hospital where she is working also?
That that we can't tell because she tested positive after me, so it could have been it could have been me.
Yeah.
It could have been
Um,
me.
and then you have a daughter.
Yeah.
JC was not, she didn't have the virus.
As far as we know, she never showed any signs. So she could have had it and she was just asymptomatic.
Mm-hmm.
She just never showed any signs and we never got her tested. So I mean, she had the two people she lived with tested positive. So maybe she was positive and she was just asymptomatic.
And then she lived with one of your friends,
Yeah,
family.
when Christine tested positive, one of our friends took her in for a couple of days until Christine recovered.
Yeah, you're very fortunate. You have a friend who was not scared to have
Yeah,
her
yeah,
in their house because that was also a little bit dangerous for them as well, right?
yeah, very much. Yeah, yeah, very thankful for that.
Yeah. Can we have Christine in the picture as well if she's
Oh, wait,
available
she has to make an
already?
entrance. Hold on. Do a twirl. Twirl.
Hello, good
Hi,
morning.
Christine. Thank you very much for being the bridge between with John here. So Christine, how was it? You had a milder form of COVID, but how
Y-
was it?
Yes, I do. So the first day, I called because I called 911 for him because he was insisting to go to the hospital to drive. I already called my hospital to inform them that, oh, I will take my husband there because I thought he can drive himself. So the nurses in the ER already told that, oh, we have a husband of the staff coming in, so they got everything ready. But then I waited for him getting dressed, and he took him like more than an hour, and he's still not ready. So I got out of the room because he was getting nebulizer because he was short of breath. So we have a HEPA filter, like a home HEPA filter. So I had it on. So usually in the hospital, when somebody gets like a nebulizer, you have to be out of the room. So I waited outside for him to be finished. So it took more than an hour already, and he's not yet ready. So I was like wondering like what's going on. And then so I came in, I saw him. He couldn't even pull his pants. He's still like
Was that the question she asked you?
no, that's what like he's getting ready. So that's when I called for 911 to him, and then after that, the first day he was in the hospital, the day after, that's when I got the feverish. So I took my temperature, and then that when registered like 101 something. Then I said, I got it.
Yeah, buti na lang yours was milder. Pero when I saw si John, his was like he was physically not doing very well, right?
Yes,
Oo,
he
so
wasn't. He was really like very sick.
while he was in the hospital, what were you feeling? Kasi JC was still with you at that time.
Yeah, so the first day na I got the fever, I called my friend, and she also has a son. So I told her, can you take GC? Because I don't know who other else can I call to take her. And she just lives like blocks away from us. So without hesitation, she said yes. So she took JC. The first day I got a fever. And then yeah, I just treated myself at home with like fever. Because with the mga Tylenol, I just keep taking medication kasi 11 days akong continuous fever.
Oo, and
Mhm.
nobody was there to take care of you, right? You were,
No, no,
oo,
ako lang. And we have our mom upstairs, but then she's already like matanda na rin. So we don't want her to get infected too. So ako lang talaga, and we're just lucky that we have friends that like come up here, bring foods, bring grocery, leave it at the door.
oo, that's
Mhm.
another aspect of being infected, afflicted by COVID kasi
Mhm.
you cannot get out. What about your groceries? So you're lucky to have friends who
Yes,
took
very
care
true.
of
Yes.
JC, who
Mhm.
gave you, who provided you with food. So it's not just the physical aspect of it that's kind of draining for a COVID afflicted person, right?
Yes,
And
that's very
then
true.
and then at that time, you were already, well, you're also lucky in a way that you're a nurse, so you know what needed to be done.
Mhm. Yeah, so I just text my our chief medical officer what to do because he's a doctor. He's our chief medical officer in the hospital, and he's really like very helpful. He will tell me what to do because it's also an infectious disease. So he just keeps
Oh,
telling
okay.
me. Oh, he even asked about John. So he said just keep hydrating yourself. If you have fever, just take Tylenol. And then I just try to take yung ano, alam mo yung what do you call this? The salt,
Oo, oo,
the
oo.
salt, yeah, the inhalation. Yeah,
Inhalation,
we
oo.
call it tuob in Ilonggo. So that's what I
Oo.
do. And I will be drinking hot tea with the fresh lemon and ginger. I have that every night with me. So the feeling I have when John was in the hospital is I can't really. When you talk to me, it's probably the same time this year when that thing was happened. Siguro I would just be crying because I'm by myself, and then I was just scared because the next thing they might call you about is like, oh, we intubated because it's like back and forth intubation.
Yeah,
So that
kasi,
and when patient is intubated, the chance of survival is really very low. And that time they don't really know how to manage it because
yeah,
it's still new.
that time, the US was not believing in the virus. The Manhattan was just so filled with so many patients. All of you were, here in Korea, the medical practitioners were a little bit more prepared, but still, uh, ang dami pa rin. There were still so many patients in Daegu. That's the
Mhm.
epicenter here in Korea. But we see news in the US, and then I got to start seeing your posts about John.
Mhm.
That time na overlook ko nga eh. I didn't even know that you had you were also afflicted with mild COVID. More ang focus with John because he was like really all those tubes in his body, and then eventually when he came home, he was so physically weak.
He can't to the point na he can't even walk. He was
Right.
even he was even like questioning me. I said, I think you have to get a physical therapy consult while he was in the hospital. And he said later on he realized like why does he need it? And he thought na makalakad siya, but he can't. It really deconditioned him from like with his condition. So yeah, so he ended up not walking at all. Just the mere fact of like standing up, he would use a lot of effort, and yung oxygen niya talaga is going down when he makes any movement.
Yeah. Can we put John in the picture, the two of
Yeah.
you in the frame?
Oh, kasha mo.
Um,
How was it? You were only, talking to each other through video calls that time. How was it, John?
uh, in the hospital, Yeah, it was hard for me because because I was on the COVID floor and I wasn't allowed any kind of visitors.
Hmm.
Um, it was I mean it was okay. I would not. It's not something I would want to do again.
Definitely, nobody
Yeah.
will wish that for anyone. Was there a time when you felt hopeless?
Uh, when I started realizing how long I was in the hospital because I was admitted to the hospital April 16th, and then when they took me to the floor that later that same evening, I fell asleep and I didn't wake up again until Tuesday. April 16th was I think a Thursday or Friday, and then I went to sleep and I woke up and it was Tuesday.
Oh,
Yeah,
wow.
I had slept for like 4 days. I didn't realize it, and then I was there again the end of the week, and then I was there until the next week, and then I started realizing wow, I'm here a long time.
Yeah,
And
how did
then
you take that? Sorry, uh, Teen, how did you take that news that he was asleep for 4 days?
I didn't even know that he was asleep for 4 days because he will be 2 days. He didn't have any battery in his cell phone, so I got worried. So my friend, good thing he works there. He went to his room and then he took a video like yeah, FaceTiming, and he said, "Ate Tin, si Kuya is still sleeping." Sabi niya ganyan. So I was relieved, at least nakita ko how he looked, but without the communication for 2 days. And then after that, at least the nurses there are good. One, and then finally they gave him a charger. He was able to charge his phone. And then every time na lang he was like just very weak and like very drowsy, yung sleepy siya.
Oo. Teen, John, how was it? Because did you ever hear stories? Here in Korea, we heard stories about couples not even seeing each other anymore. Because one
yeah,
of them got afflicted or both of them did, but they could not be visited, they could not see each other, and then that was the end of it. Did that thought ever occur to you also?
it did to me when after that first week I was there. Because you have to that first week I was there, I thought that was it. I was really really in really bad shape. That first week I was in the hospital,
Your father died.
and my father because and my father had just died.
From
My
COVID, right?
Yeah, he had just died just a few days before. Yeah, from COVID. And that first week, when I finally woke up, they brought me to a new room, and I was really in bad shape, and I wound up asking the doctor if I was gonna die. Like
Oh,
I just wanted him to let me know, like, am I gonna die?
yeah. I mean, that was a very scary situation, knowing that your father, they already told you about it, about your dad,
We found
No, we found him dead
before you went to the
before
hospital.
when before I went to the hospital. Yeah,
Oh my.
yeah.
So
My dad died April 8th, and I was admitted April 16th.
that must have been a very, very challenging situation for your family.
Yeah, yeah, very much so. Yeah, yeah. It was hard for us because we were worried. My family was worried about the COVID, so they were isolating from each other. My mom and my dad, because my mom had retired, but my dad was still going to work.
What was
So,
he doing? Was his work?
he worked for the post office.
Oh, all right. And your mom?
She was a nurse administrator before, but she had retired.
Ah, all right. So
Yeah.
she knows how it's done because she's also in the medical field.
Yeah, yeah.
Pero
So they,
grabe, the thought of, of not being able to see your family again because it happened with the both of you, with your family, parang it's a lingering thought. Was it a lingering thought? Kasi that was the reality for other families at that time.
yeah.
I really
I was like after that first week or so when nobody was telling me what was going on, like they weren't telling me, oh, you'll be here for like another 2 or 3 days and then you'll go home. Nobody was telling me that. and nobody was giving me like, oh, like normally when you have surgery or you're having a procedure done, they'll say, oh, you'll be here for like 3 days, 4 days, and then you'll go home.
Right.
Yeah, nobody was telling me that. So at the beginning when I was in the hospital, I really had nothing to look forward to because they never told me like, oh, maybe 10 more days and you'll go home. I was just
Yeah.
there. I was just there.
Yeah. And then eventually you came out of the hospital after 26 days.
Yeah, I was discharged May 12th. Yeah.
Grabe. Tin, how was it feeling that he's not there with you for 26 days?
Oh, I was just hanging on because I'm hopeful. I didn't think he will die or something like that. A lot of my friends will ask me. I just got scared every time my phone rings because that's when the doctors they are very helpful because I text them. They don't usually do that, but they will
Uh-oh.
text me back, and then I don't want to keep bothering the nurses and ask them like how is he doing because I know how the situation is. So I would call in the morning and then I will ask for his laboratory, how is he taking, kasi the next step to what he has is intubation na kasi he has the high flow, may non-rebreather mask pa. And it's really, even the doctors tell him to fight, right? Like he was like, no intubation. They will tell him you have to. They keep trying to titrate yung ibabaan yung oxygenation niya for the first 2 weeks he was there, but he wasn't able to tolerate it. So they keep trying and trying. That's why it got longer and longer and longer. So I just keep telling him na kasi at the there's a point na he was already getting impatient. Like, I want to go home. I said, you want to go home and what? Do you want to die here? So inaano ko
Oh,
siya that like you have to hold on. You have to
tough
help
love,
yourself.
no?
So that's what it is. So I just took it one day at a time and just keep praying. Really, like that's what all I do. I just keep praying and praying and praying. Mm.
Right. Kasi at that time, what was there for you to hold on? Kasi
Yes,
he was not around. And then in a way, you're very lucky because you have access to some of the nurses in the hospital who were able to tell you information. Imagine some families who,
Yeah.
yes, that's
had
true.
no one to turn to ask, and then just, you know, before they know about it, it's gone, no more.
That's true. Because
Yep.
I seen a lot na they nagugulat. Kasi COVID is really fast. We will have patients in the hospital that we will be walking in the morning, and by noontime,
Wala na.
we will call. Wala na. And
Oo.
we're really helpful of the people that's around us. Kasi even our doctor in my hospital, when I ask them, they will tell me, like the pulmonary doctors I work with, they will tell me and suggest to me what will I ask his doctor. And was he given the plasma? Was he given this? Because syempre, ibang hospital, different rin naman yung mga protocols in treating it, like the medication. So it really helped that they suggest, and then I ask, and then when I ask for the convalescent plasma, maybe the next day or two, they give it to him because I have one friend that they said in New York, her aunt, it took them a week. They were begging and begging daw to give her the plasma, but they weren't able kasi that time may shortage na rin.
Oo. Oo. Grabe yung mga news about the shortage there in the US at that time.
Yeah.
For those who still, after a year, do not believe in COVID, this family can attest, have lived, that time with fear about COVID and lived through the struggle of having COVID. The the struggle, the fear didn't end in the hospitalization.
No.
What happened after John came home? Because he was so totally very, very weak. How was it?
Oh, the first day. The,
That's
Uh,
another challenge, right?
yeah. I didn't realize when I was in the hospital because I was in bed for
In
26
bed,
days.
yeah.
I did not realize that my body had had completely shut down. And so when I came home, I couldn't walk. I couldn't even walk 6 feet without losing my breath and like falling down. So when I came home that first night, I wanted to take a shower because I hadn't taken a shower in 26 days.
Wow.
So we walked to the bathroom, like Christine was helping me, practically basically carrying me to the bathroom, and I sat down. We put a chair in the shower, and I took a shower, and I completely lost my breath.
Yeah, it's like 7.
I was like,
Because the good oxygenation should be at least normal. It should be at least 90 and above sa monitor.
Oo.
95 and above for us healthy people, it's okay, but like 90 and below, it's not good. So he insisted. So I trusted him. So I said, "Oh, let's go to the bathroom." So he went there. The O2 saturation went to like 75, 76. I got scared a little bit, but I said, "Just keep breathing." I keep reminding him, "Keep breathing, keep breathing, keep breathing." Kasi that time, we have the oxygen tank delivered already dito sa bahay. So I hook him up in the oxygen tank, and we don't have any wheelchair. So what I did, I used yung chair, the regular chair, and
Oo.
he's a tall guy. He's almost 6 feet, and he's big. So I told him, like, we're not doing this again. Hindi na natin to gagawin ulit. So I said, hold on to the chair, and I will pull you back in the living room. So I hold him to the chair, tapos inano ko siya. Like, I drag him papunta sa living room. I said, "Oh, we're not doing that." Kasi that time, hindi pa dumating yung mga things we needed for him to go around, like the commode,
Mm-mm.
like yung parang chair with a basin
Yeah.
na he can use it sa living room. Everything we do in the living room, taking a bath, like doing like personal stuff, urination, bowel movement, everything sa living room. Kasi he can't, even like how many steps, even like maybe 12, like 6 steps, he can't. He gets out of breath. So that took like a month that I do it by myself and with the help of our physical therapy friends doing virtual.
Virtual
Kasi
lang.
virtual kasi that time, the visiting nurse, which is scheduled for him to visit us, and then visiting physical therapy, according to their company's protocol, when the patient is still COVID positive, they can't come in the house. They have to wait until he's tested negative. Then that's when they started coming in. So it's really me and him working together, and with the instructions and with the help of our
Oo nga.
friends. And
Oo
yeah,
nga, Tin. Kasi we were monitoring, not really monitoring, but we see your posts in
yeah,
Facebook that time. But those posts were just a part, a second of your life there. So at the back, behind all that, the struggle must have been really, magnified 1,000 times. Ano yung feeling? Buti na lang nurse ka and you know all these terms. But then again, tao
yeah,
ka din. You have your own needs and you're also a COVID survivor no matter how mild. So parang your focus that time was on John,
yes.
not on yourself, right? Ano
No, I
yung
don't think, because
struggle?
for me, sabi ko, ay, kaya ko yung self ko because I know how I feel. But for him, I can't really trust him anymore because that time he would say, hey, I'm okay, I'm okay, I'm okay. I said, I even got mad at him. Why you didn't tell me that you're having a hard time breathing? I said, I wasn't keeping it. It just happened like very quick. Mabilis lang talaga siya. So it's not like he said he tried to like hold it or he tried to keep it in him.
tiis lang.
Yeah. That's what he said.
Tiis.
Like I said, tiis. He said hindi. He said hindi daw niya tiniis. He said he just.
No, as one thing you have to understand, and the viewer should understand is, I tested positive. I'm not tested positive. I woke up with a fever April 7, and then
Oo.
for like the next week it was just a fever. I had no other symptoms
Yeah.
besides the fever. I
cough.
I had no cough, no shortness of breath, no headache, no stomach ache, no diarrhea, nothing. I really had nothing but the fever, and the fever wasn't even that high. It was only like 100
Mhm.
point something or 101. So if I didn't tell you that I had a fever, you would think that I was perfectly normal.
But you were weak. You weren't eating. I think
But
it's because that.
no, but that was only for the last
Yeah.
day or so. But I was taking Tylenol, I was resting, I was hydrating, but the fever never went away. So I just decided to get the COVID test. But a lot of people are saying, "Oh, did you have all these symptoms? Did you do this? Did you lose your sense of taste?" Like, no, I really had no other symptoms besides just the fever. I was physically I was okay. I mean, if I had to go to work, I could have gone to work. All I had was the fever.
And he doesn't have any hypertension.
Yeah.
He wasn't diagnosed with any comorbidities, nothing like that.
Yeah,
He goes to the gym. Yeah.
Yeah, I was. Remember, you have to understand. I was 41 years old. I was in pretty good health. I never smoked. I never smoke. I don't drink. I never did any drugs. By any measurement, I was in really good health. And so all I had was the fever. But just for one reason or another, April 16th, I woke up April 16th, and I just couldn't breathe.
Yeah, it was very sudden for you, and also the realization that you are physically weak and dependent.
Yeah.
How did it take its toll on you, on your psyche, on your relationship then? Was there a time now you almost, have to give up, but or not at all because you only have each other to hold on to?
No, the thing that worried me the most was the breathing, because I knew, like, eventually I knew, like, my strength and my legs would come back. It would just take time. The thing that bothered me was the breathing, because every little thing I did, I couldn't breathe. Like, if I moved from one couch to the other, I'd be like sucking on air, like on oxygen. I couldn't breathe, and that was really the thing that got me worried. Because I knew eventually, like, my strength and my arms, my legs would come back. The thing that worried me the most was, like, how are my lungs going to be, like, a year from now, 2 years from now? Is this something that's going to be around, for the rest of my life?
Yeah. So it's good to hear, John, that you had that optimism, you had that positivity, that physically you'll be back in, you'll be walking again. I
Yeah.
mean, without the aid of those equipment or of tin. Um, until now, what until now? Do you still have difficulty or
Yeah.
shortness of breath?
Up to now, I still get short of breath. Like, if I do, like, when we're grocery shopping and I have to bring groceries from the car to the house and it's, like, heavy, I get short of breath. My baseline O2 now is 95, which is still normal. It's 95, but my baseline before COVID was like 100, 99 to 100. Now every time I put on the O2 machine, it's always 95. Doesn't start.
Sorry, from a non-medical person, O2 machine is the oxygen machine.
Yeah.
No,
The O2 measures the oxygenation in the blood.
Oxygenation in the blood. So
Yeah.
is that permanent in your house already?
Yeah,
It's a small
it's
thing.
just a small thing. It goes on the
Oh,
finger.
okay.
Yeah, it's portable.
Yeah.
Anybody can buy it. It's good to have.
Yeah. So my O2
Obviously,
before,
hindi, wala akong alam, ha?
yeah. So my O2 before COVID was normal. It was like 100, 99 to 100. Now it's 95. And 95 is still normal, but compared to how it was before, it's a few points lower.
So, like,
Yeah,
because the effect still lingers, the effect is still there on you, John. How is it? How's your day-to-day life? How's your... Kasi I still see you before, after the physical therapy in the house, you went for rehab, right?
Yeah. Yeah,
Um,
I went to rehab for 4 months. Yeah,
4
three
months.
times a week for 4 months. Yeah.
Friends, see, John stayed in the hospital for 26 days, and you were not working for 8 months.
Yeah.
So how many months did you have to do the therapy in the house?
So I was in the hospital for almost a month, and I was discharged. I sent home. Then I was it was just in-home nursing for about another month, because the PT couldn't come to the house because I was I had to be negative for the COVID. So finally he came for about another month. And then I went to the rehab center for 4 months. So altogether, it was about 6 months worth of rehab, both in-house and in the clinic.
That takes a lot of patience and determination for you to have to go through that.
Yeah.
Didn't you ever doubt that you will be going back to work again?
He's been wanting. I've been
No,
wanting.
I actually had been wanting to go back to work. I was originally scheduled to go back, so I left work April, and I was supposed to go back August, but then I was never cleared to go back. I was not cleared by my doctor to go back in August, and then I was supposed to go back in December, and I was not cleared to go back. So finally, they said, okay, you can go back in the new year in 2021. So I said, okay, we'll go back in January 11, 2021.
Yeah, but you had your vaccine prior in December,
But the first shot, yes, and then I got
the
my
first
second
shot.
shot in January.
You and Tin, did you
Yeah,
have it together?
yeah,
Yeah, friends, yung mga medical practitioners sa US, they had their first dose of the vaccine December 2020.
Mm-hmm.
Sa atin dito sa Asia, the vaccine came a little bit later na. Pero you were a priority because one, you were in the hospital, and
Yeah.
two, you had the COVID.
yeah, yeah. We were one of the first to get the vaccine. I think my hospital where I got it from only started giving out the vaccine a week prior. So I got it with I got my vaccine within a week
Yeah.
of them giving it out. Yeah.
He was
How
out
was
of work. Sorry. He was out of work when they gave him the vaccine. So they accommodated him. Kahit hindi pa siya nakabalik sa work, they let him come back to get the vaccine.
Yeah. Ano, pero what about the benefits while you were recuperating? Hindi
My
ka
my
naman the benefits,
The work.
sweldo.
Oh, my work benefits. Oh, uh, I'm the type of guy that goes to work. I don't really call out. So I mean, maybe the whole year, maybe I only call out maybe twice the whole year because I don't know, I don't really call out. So I
Call
worked
out
there.
means,
Yeah, I had worked at the hospital for over 10 years, so I had accumulated like hundreds of hours of sick time. I think from when I got sick, I had almost 600 hours sick time because I never called out.
And the rest is disability.
And the rest was just vacation days and my personal days. So my sick time, all my benefit days put together, carried me from April to about August. So and then from August until I came back, I was on disability.
okay. Buti
Yeah,
naman. Pero what
yeah.
about those who did not have the same number of days as you had? Ano yun?
They have.
Oh, then they're in trouble.
Yeah.
But the government here is very accommodating, I think, to the
Yeah,
point that they abuse it because they increase the disability, the money, right? And then they even add up to they lengthen the days and the months, I think, because it has a limit. They lengthen it because of what's going on. Mhm.
Ano, can we go back a little? Because I remember my picture, there was a picture of JC. There was a picture of Jay-Z with that cover, plastic
She
cover,
was clapping.
separating you from
yeah,
her.
yeah. That
How
was
long did it
The
have
first
to
time.
be
that was
done?
when I came home from the hospital. Christine had set up the isolation because I was gonna stay in the living room. So Christine separated the rest of the house from the living room. So she put the plastic barrier there so for a droplet precautions.
I put plastic separation sa banyo, in between, basta sa mga doors, JC's room, all her utensils are lahat disposable. This was even before we got really sick with COVID because we already observed isolation. So that's the first time when John, because every day I would make the chair, kasi may chair kami na parang mark na up to that point he will walk, and then
Oh,
as the days goes, goes further and further and further. So that day, that was the longest he was able to walk, and JC watched him, and she actually, it made us into tears because she clapped to cheer her dad when she
oo, that
saw
was,
him. Yeah, when she saw him walking up to almost nasa bathroom. Kasi our goal
uh-huh.
really is for him to walk to the bathroom. That's the goal.
Yeah,
Mhm.
that must
Mhm.
have also been very emotional for JC, seeing her
Yes.
parents and her dad going through all that.
Yeah, and her lolo passing because that's the person that's really closest to her.
Yeah, I tend to forget about the grandfather pa
Yeah.
pala. Grabe, no? Patong-patong kayo
Yeah,
that time. Yung
even
last
with
year talaga.
mhm. Even with my
Pero,
mother-in-law, she's like hindi pa natapos yung we didn't even got a chance to mourn really to
right,
about my dad's passing because in between siya na naman. So it's like continuous. Mm-mm.
right. Are you an only child, John?
Yeah.
Ah,
Mm.
yeah, that must have been really, really tough. Pero John, nung mga progress mo, physical progress mo, ano yung feeling? Tapos eventually you were able to go out for the rehab. Did
Uh,
you appreciate as each day comes, as each movement, brings you further and further?
the thing I appreciated the most was being able to drive again.
He was
Uh-huh.
driving.
Yeah.
He was driving with oxygen tank.
Yeah, I had the oxygen tank on the
Ah!
side so I could drive. Yeah.
Yeah, we would walk outside sa labas na may oxygen tank. Yung mahaba lang yung tube so he can exercise. And this is every day we do.
Grabe, of course, it helps a lot then, yung dedication mo tin, ba? And of course, your knowledge about the medical side of it. Kasi it's doubly hard triply hard for those who are not in the
That's
medical
true.
field.
Mhm.
Um, Tapos, how was the feeling when you eventually went back to work and then there was that welcome party for
Yeah,
you?
yes,
Kamusta
it
naman?
was
How was
nice.
it?
It was nice. My coworkers had set that up. Um, I was a little. I was anxious going back to work. I was worried like I would have forgotten everything, like how to do everything. But they were so happy to see me. I hadn't seen them since the previous year, so it was nice coming back. And it took me like a week to get back into the flow of things, but it was nice to be back. Get back to normalcy.
Yeah, was it emotional? How did you take it? Were you teary-eyed?
No,
Kamusta naman?
I was happy. I was happy to see them, and I was thankful for like to finally be around people because we've been at home the whole time, and I didn't see anyone else. So it's finally
8 months,
yeah,
right?
it was nice to like to interact with people again.
So now, what is the situation in the hospital? Do you still have a lot of COVID patients there? Or,
Oh, it's still the same.
as Tim said,
When I left back in April, the hospital was really making a point to isolate COVID patients from the regular patients. But the hospital got so overwhelmed that basically every patient was a COVID
Yeah.
patient. So basically, the emergency room is just instead of having individual isolation rooms for the COVID patients, basically everything is a COVID room.
oh, so now when you went back to work, are you more confident this time because of the precautions in place?
Yeah,
Is
actually,
there
yeah.
still
Um,
fear?
Actually, yeah. The hospital and my department in particular made changes to try to minimize the exposure to possible COVID. Because, like I said, COVID is one of those weird diseases that you could be positive for it and not show any signs of it.
Yes, yes.
So
But then again, also, your physical health, no matter how physically fit you are, is also not an assurance
Yeah, just
that,
like
yeah,
you will not be badly hit by COVID. A prime
that's true.
example is you.
yeah,
Yeah.
exactly, yeah. Um, I actually personally know four people that died from COVID, and they were in perfect health. So
Mm-hmm.
it's A lot of people say that, oh, I don't have diabetes, I don't have high blood pressure, I'm not
I'm
overweight,
young.
I'm young, I don't have to worry about it. And I'm like, it doesn't matter. If it's gonna get you, it's gonna get you.
Yeah, in fact, no matter how much precaution you take,
Yeah,
That's true.
you'll never know.
yeah.
Mm.
I
Alam mo,
also
if this
find
is,
that a lot of people that complain about how long the pandemic is taking are the same people that are not doing anything to try to stop the pandemic. They're
yeah,
complaining
so
like, oh,
that,
this pandemic has been going on for a year, but yet they walk around without any mask on. They're going to barbecues, they're going to birthday parties. I'm like, you want the pandemic to stop, so do your part.
yeah, I remember posting about this party in one of the states in the US, and then you reacted to that, right, Tin? And then that's when I realized, oh, of course, she has every right to. I think you reacted with an angry emoji. Of
Yeah.
course, she has every right to react that way because both of them works in the hospital, and both of
When
them,
we see it,
especially John, went through so much because of COVID, which
uh,
brings us,
A
which
lot of
brings,
people, for some reason, a lot of people are saying, oh, this is just like the flu, or this is just like having a cold. And I know several people that have had COVID, and not one of them have ever said it was just like the flu.
oh,
Not one of them has ever said, "Oh, this feels just like the flu," and it's not. It absolutely is not. And the problem a lot of people are having is that they see the death rate of COVID as only being like 1%. So they see like a survival rate or survival rate of 99%, and they said, "Oh, that's fine. If I get it, I'll get it." A lot of people don't understand that 99% survival rate doesn't mean that you're just sitting at home watching TV on the couch. That 99% survival rate includes everyone who survived COVID. I would be part of that 99%, and I spent a month in the hospital. Like
yes.
a person that has a double lung transplant to fix her lungs because of COVID and survived would be considered part of that 99%. A person that spent 2 weeks in the ICU on a ventilator and survived would be considered part of that 99%. So a lot of people say, "Oh, it's 99% survival rate. Why are you worried about it? The chances of you surviving are 99%." That may be true,
we didn't know what they go through.
but you don't
Yeah.
know what you have to go through to get part of that 99%. There are some people that get the flu, I mean, that get COVID and wind up with just a runny nose. And then there's someone else who gets COVID, winds up in the hospital for 2 months. But
Yeah.
they would all still be part of that 99%. So I'm just saying, everybody's saying, oh, it has 99% survival rate. Why are you so worried? It's 99% survival rate. Yeah, but you never know what you have to go through to get to that 99%.
Yeah, I do understand and I do empathize with you because it's hard for us to, we just hear statistics.
Yeah.
That's true. Because I
But,
have one friend that came up to me. She said, "Is it really happening? Can you
oh
imagine
yeah, she
this
was
one?"
still unbelieving.
Yeah. So is it really true? Because they know that I'm a nurse, like that people died, like people are dying. I said, yeah. So in the hospital where I work, my social worker came up to one of my coworkers and asked, "Is this really happening? I can't take it anymore," because her job, not just a social worker now, is calling family members that their family died in the hospital. And she said she
Oh,
even came up to a point that in a day, 28 families she has to call to tell them that people like their family member died
family.
of it.
It's COVID is one of those diseases because of what happened in the United States that's become very political. It's either you believe it or you don't. And it's weird because some people just don't believe COVID, but yet they believe in other diseases.
Yeah.
It's one of those things that you only believe it if it happens to you, but yet you believe in HIV, and even though you've never had HIV or know anybody that has had HIV, but you still 100% believe that HIV is real. So how come you don't believe that COVID is real?
Yeah.
It's one of those
Here,
weird things.
yes. We find it really, we cannot understand because at that time we already believe, we were already doing everything we can to protect ourselves. And yet, America, the US, they're
Yeah,
still very unbelieving until you're one of the numbers. You're one of those in the statistics who went through that. And
it it it
unfortunately,
it really had to do with the government of the United States at the time, with Donald Trump's government. When Donald Trump had the rally, and this was like very like in January when COVID was just coming around to the United States. When Donald Trump said that COVID was the Democrats' new hoax to try to get him because they
uh-huh,
failed with the
uh-huh.
Russian probe. But as soon as Donald Trump said that this was the Democrats' new hoax, that was it. Like 50 million Americans, just that was it for them. That's it. They don't believe it anymore.
which is true.
That was
That
it. They just completely shut off their minds and said, okay, Donald Trump says this is the Democrats' new hoax to get him. I don't believe that this is real.
Yeah, that must have been really frustrating, especially for those of you who were going through
Yeah,
that or who went through that. Well, it's like you want to shout, please.
it's a, it's strange. It's strange living in a country where politics and science don't meet together. Don't it's like people are believing a president that has no medical training whatsoever and completely ignoring people that have spent their entire lives studying diseases, and they're telling you they're telling you something and you're just not believing
Yeah.
them. It's just weird.
Yeah.
It's just weird.
And during
So
the
for you,
first Sorry, and during the first wave, there's no clear protocols. Every week in the
right.
hospital, it changes. Even CDC. That's why we're so confused too. Like, oh, the next day they will say, oh, it's okay to wear the mask. Oh, it's okay to wear this. Oh, like them. They're told, like in his hospital, right? They said, oh, you don't need to wear it. And then the next week, they said, oh, you have to wear
You have
it.
to wear the mask. Yeah.
And then I think it's not really prepared because we ran out of PPE. We have to use one mask for the whole 4 hours, the same patients, even the PPE. So we're not really prepared. But now it's better, and that's why we're here, because we wanted to share our experience and to tell people that
Mhm.
they really have to cooperate with what's being said by wherever country you live in, just to minimize this pandemic. Because now in our hospital, it's getting a lot again, but it's not as bad as it is compared to the first year, but it's still a lot. We still get patients, like right now it's like where I work, it's increasing again, and we still bring people to the ICU, and we still have dying patients. Like in like a week, sometimes we get two cold. Now we don't call cold, but we will have patients that dies. I have patient that died on my floor the other day from COVID. But yung mask talaga really helps. The masking, social distance, hand wash, and the vaccine. Because thank God, so far I'm exposed since I got back to work. I got back to work July. Thank God, even if I get the COVID patients, I didn't have any symptoms. So whatever we're doing, it really helps. Yeah.
Yes, Tin. Ang grabe, there are still people who are not believing this virus even after a year of the world struggling with it. Um, January was very special to you, to your personally special to you, John. One, you went back to work.
Mm.
Second, you have a new
Another.
president who is not making the COVID situation political anymore. So somehow, did you feel safer after that when new protocols were in place already?
And then you got the vaccine.
Yeah, I felt
And
better.
then the
Like
vaccine, of course.
it was. I just never. I mean, I felt better because the vaccines were finally rolling out in the United States. People were getting the vaccine finally. It was just weird that I never understood how you can argue with someone with a scientist or a medical professional that spent like literally their entire lives studying this disease, or not this particular, but studying infectious diseases, and arguing with that person.
Uh-huh.
And like, especially when you yourself have no medical background. I never understood that. And especially when you have a platform as powerful and as widespreading as the presidency, how you can argue with people like that. It would be like me arguing with a Nobel Prize winning mathematician saying, no, no, 1 plus 1 doesn't equal 2. What are you talking about? That's wrong. It just made no sense. I mean, like, science is science for everybody. I mean, it really made no sense. And the thing that I never understood is why COVID in particular are you arguing about? But every other disease, you're willingly following what the doctor is saying. But every other disease, you tell me, oh, you have cancer, have surgery. Okay, let's schedule the surgery. Oh, you have gonorrhea. Okay, take penicillin. Okay, I'll take the penicillin. But COVID, oh, you have to wear a mask. Oh, you're I'm not wearing a mask. What are you talking about? You have no idea what you're talking about. It makes no sense. But every other disease, if a doctor tells you something, you listen to the doctor. But for some reason, the doctor tells you, oh, you have to separate, you can't go to birthday parties, you have to wear a mask. Like, oh, you can't tell me, you're not the boss of me. I'm gonna go to the party no matter what. I'm like, what the
Oh, can
fuck?
you imagine?
I don't understand
May
that.
mga anti-maskers, like they even
Right.
came up with the term like
I
anti-maskers,
don't
and like
understand.
anti-vaccine, like that.
It just boggles my mind. Like, you could go to your doctor, who you could have seen this doctor for 20 years, absolutely professional doctor, and you follow his advice on everything, and then suddenly he tells you about COVID and tells you have to wear a mask, and suddenly you're like, nope, I'm not wearing the mask.
Yeah,
Nope,
their rights are violated.
you're violating my rights. I don't need to wear a mask. I'm like, but for
Yeah.
every other thing, every other problem you have, every other medical problem you have, you trust this person with your life. But suddenly, when he tells you, oh, you should wear a mask, suddenly the mask becomes an unbearable burden.
Yeah.
It
For
makes no sense. I don't understand that.
We have a very different culture, the East and the
That's
West.
Yeah,
The simplest way of differentiating it is the Western culture has a very individualistic,
yeah.
approach to this is me, my freedom, this is my life,
Mm-hmm.
yeah.
not caring about what the other person will go through based on the consequences of your actions. It was kind of easier for people to follow here because we are more on, more on community. We think about the community. John and Tien, now that the world, we expected the world to be better this 2021. It
Huh?
may be better because we have the vaccine, but we still have cases and cases and cases of COVID.
Mm-hmm.
Coming from you, what do you want to tell the world? Please, what can we do? What do you advise us to do?
I say, I mean, if you can get the vaccine, I mean, whatever vaccine, the best vaccine for you is the vaccine that's available, right? I mean, if the vaccine in your country is if the only available vaccine in your country is this particular vaccine, then take that. Don't hold out and say, oh, I'm waiting for the Pfizer or waiting for the Moderna vaccine. The best
Yes.
vaccine available is whatever is available, whatever vaccine you can get. And if for some reason you don't want to get the vaccine, you're worried about it, whatever, then just do whatever you can. Like, separate, wear your mask, wash your hands. You have to think twice. Is it really important for me to go to that barbecue? Or, like, is it really important for me to go to that birthday party? Or is it really important for me to go to that nightclub?
Yeah, especially if you don't know the people.
Especially if you don't know the people there. A lot of people think that you can only get COVID from, like, patients or from strangers. And that's absolutely not true. You can get COVID a lot easier from your friends and family than you can from strangers. Because if you think about it, you don't spend too much time talking to strangers. You don't spend too much time sitting next to strangers, but you're hugging and kissing and laughing and eating with your family and your friends. And that's how COVID spreads. A lot of times, especially at work, I see my coworkers, they're head to toe in PPE talking to patients. And then, but during lunchtime, they have no mask, they're hugging and kissing, and they're talking to their coworkers and sharing food. I'm like, you can get COVID a lot easier from your friends and your family than you can from strangers. So just keep that in mind. A lot of people think, oh, these are my friends, they're safe. But how secure, yeah, your friends may be safe, but how secure are you that the people they're hanging out with are COVID free?
Mm-hmm. True. We have read stories about, one person going to a party and infecting
Yeah,
all or most of the people there, and then they go home to their respective
Exactly, yeah.
families, and that's when the
yeah, just like
wala na. It
those.
has been blown out of, that infection rate has gone spread uncontrollably already.
Yeah, like
Yeah.
yung sa balita sa Philippines, like 18 of them were all positive, nag-reunion sila. So, so yeah, it's really that social distancing,
Yeah.
masking, hand washing. If you can get the vaccine, get the vaccine. But vaccination is a personal choice. But for us, we did not hesitate. As soon as they said they're giving the vaccine, we got it, and that we experienced the symptoms. It's not that bad. It's bearable. Pero yeah, I'd rather have that
Yeah.
than spend my days in the bed in case I get it. Because
A lot of times, like the number one message is, I guess, if anything, the number one message is that you can get COVID a lot easier from your friends and family than you can from strangers. Like a lot of times people say, well, but I don't go to parties, I don't do this. But yeah, but you're hanging out with your friends at home. And can you honestly say that you know exactly who your friends are hanging out with? Like my uncle, I have an uncle, my mom's younger brother. He passed away a couple, like
just
just recently, like a month and a half ago from COVID, and he never went out. He doesn't go to parties and that, but he had a fishing. He had a fishing trip, like a fishing trip that he normally goes on, and one of the people that showed up to the fishing trip had
the
COVID,
family. Yeah.
and he got that COVID from his own family, and he wound up getting COVID from this friend, and he passed away.
This was February. He
This was
lives
just
close to us.
this was just this past February. So a lot of people think that, oh, I'm not talking to people, but you can get COVID 100% easier. Like me, I got COVID from my coworker. I didn't get it from a stranger. I didn't go to any parties. I didn't. Whenever I went shopping at Walmart, it's not like I spent 20 minutes talking to the cashier or hanging out with somebody in the aisle. I just went to Walmart, bought my groceries, and I went home. I got COVID from a coworker. So everybody should keep that in mind. Like you can get COVID a lot easier, much, much easier from your friends and your family than you can from strangers. So just keep that in mind. Like thinking like, oh, I'm doing my part. I'm not talking to people like I'm not talking to people in the malls. Yeah, but you're
Yeah.
you're going to your friends' birthday parties. You're going to your friends' barbecues, and I don't think there's any people wearing masks at the barbecues.
Yeah, instead of like complaining, like just follow simple precautions because eventually I don't really think this COVID will really, really go away. Probably it might end up like another flu. Like every year we get vaccinated.
Yeah.
But if we just follow protocols, like we follow simple things that we can do, like little things, it at least it can make our world a little bit bigger. Because the more we don't follow it, we're just gonna be like this. It's just gonna be nonstop quarantine, nonstop limitations of how we are going to live by day. So yeah, that's the message we want. That's why we agreed to this
Yeah.
interview. It's really to share our experience and also to be an eye opener to those who still like, oh, it's okay. I will get it. Maybe baka inuman ko lang ng Tylenol, okay na ako. Inuman ko lang ng fever medicine, okay na ako. You know? So, yeah.
Yeah, that's why I'm also very, very thankful, grateful for you to, I know you have, your schedule is night shift, day shift, and
Yeah.
all that. Swerte lang that, you're you don't, both of you don't have work today, and I
Yes.
really appreciate your coming in this frame now and sharing with us what you went through. It was not a joke, it was a year of
Mhm.
struggle. Our
Yeah.
takeaway for this tonight is, no matter how we may think the world is better now because there's vaccine, we should never put our guards down
Yeah.
because it's still ongoing. There are still people affected. There are those people who are part of the statistics are not just statistics. They went through something unimaginable for us who didn't go through
Mhm.
it. But we just have to believe that, we can do something from where we are, from where we stand, from where we sit by complying to all these protocols
Right.
and making it by doing that, we make it a little bit better for the people around us and for the world in general.
Yeah.
Thank you very much to all of you who have been, with us since the beginning, and to those who will be watching the replays. We hope you got something from this, and all of us are super thankful to John and Christine for sharing with us their story tonight. Always take care, John and Christine.
Thank you.
Thank you.
Thank you for sharing.
All right.
Thank you, everyone, for sharing with us your messages. I didn't have the time to, acknowledge your messages anymore, but rest assured, we read them and will be reading them as soon as it is available. The replay is available in YouTube. Thank you very
Thank you.
much.
Thank you.
See you
Hello.
again next week. Good night.